Lunch Walk and Talks, let's talk about low back pain. While low back pain may not be the slick whiz-bang topic like heart disease or the latest genetic test, it is a significant portion of Australia's burden of disease. Lower back pain is the highest cause of loss of productivity, early retirement and income poverty from a study in 2018 to 2019. Low back pain is a common back problem that causes pain, significant psychological distress, and impairs work function. So what do you do if you get low back pain? The Australian Low Back Pain Clinical Care Standard has 8 specific recommendations that are made for people over 16 presenting with acute back pain. The first step I'd recommend, as per the Clinical Care Standard, is an assessment with a registered health professional doing a diligent history and examination of your back. During that assessment, it is important that you are screened for both atypical causes of back pain, as well as looking for signs of social distress or increased stress. Unfortunately, back pain often coexists with psychological distress, anxiety, and depression. After an assessment by your registered health professional, be it a GP or a physiotherapist, you can then go on to have imaging if it's needed. And this is a case-by-case basis, and there's a judgment your health professional makes depending on your pain, where it is, its features, and the history. Some back pain may actually not need imaging, and sometimes you can be spared the radiation of an X-ray or a CT. I try to always have people leave my room with an educational handout and try to empower them with an understanding of what's going on with their back pain and what they can do to manage it and prevent further occurrence. I see a lot of tradies, a lot of electricians, a lot of plumbers, all who struggle with their backs at some point. And I don't want them to necessarily have to come and see me if they can manage it themselves. The next thing is talking about physical activity. And here we are taking a beautiful lunch walk through Kirrawee. While some back pain may require an initial period of rest, the evidence suggests that early introduction of physical exercise, whether it be a nice walk, actually helps recovery long term. So if you have lower back pain, it's always good to get involved with a doctor or a physiotherapist early. We'll always check you for signs of musculoskeletal disease, as well as looking at what social stressors might be combining to give you pain. This is Lunch Walk and Talk. I'll be back next week.